My name is Faisal Jahangiri. I'm Vice President of Clinical Affairs at Access Neuromonitoring. Today we are going to talk about head measurement according to International 1020 system. And this is one of the very important part of the neuromonitoring, and most people, they skip that and do the head measurement by guessing that, and which is not an optimal thing to do. So that's why we are focusing on this topic today. So head measurement is very important. Why it's important? Because if you place the electrode at the right spot, you get the best signals. And if you by placing the guessing that, you are not going to get a correct response. The response may be upside down. It may be a small response or a very absent response or different type of response. And you may not be able to understand that because you are assuming that the electrode in the right place. So in order to avoid those confusion and avoiding the different interpretation, we have to make sure you're placing the electrode on the right space. On the other side, if you're placing the electrode for motor evoked potential and you are not right on the primary motor gyrus, you have to stimulate at a higher threshold. What happens is when you're stimulating at the higher threshold, the patient is going to move a lot. And when the patient moves a lot, the surgeon get interrupted because the patient is moving in the surgical field, and the surgeon will have to tell you to stop the surgery. Just a step back. Yeah. So if you stimulate at a higher voltage, what will happen is the patient is going to move a lot. When the patient is going to move, the surgeon have to stop the surgical procedure in order to run MEP, and they will tell you not to run MEP continuously. So if you place the electrode at the right spot, you can activate motor fiber at a very low threshold, and you can do a very continuous and frequent motor evoked potential. So that's why it's very important. And in order to do that, you have to make sure when you walk into the preoperative area to talk to the patient, you have a flexible, a small measuring tape and a marker to mark that head, and inform the surgeon and the patient that you're putting the electrode because you're putting these points for the electrode because when you go to the OR, patient is under anesthesia, you can place the electrode at the right spot. So the first thing we are going to do is use this measuring tape and measure from Nasion to Inian. When you measure from Nasion to Inian, you have to measure in centimeters, not in inches. So that's point have to be remembered. It's always in centimeter. So if the distance from Nasion to Inian is 40 centimeter, you go 50% of that. So the 50% of that 40 centimeter is 20 centimeters. So you mark that point as CZ. Now we measure from A1 to A2. A1 is in front of the left ear, A2 is in front of the right ear, and measure the distance between them. If that distance is again 40 centimeter, you go 50% of that. And the crossing of the first 50% and the second one is the true CZ point. That's we are going to mark as CZ. So the next step is to measure 20% of the distance between A1 and A2. It has to be the total 20% of the total distance, not 20% of the 50%. That will be 10% of the total. So 20% of 40 centimeter is 8 centimeter. So we place a mark, we mark a point on the right side of CZ at 8 centimeter, which is C4, and we place another mark on the left side, 8 centimeter, which is C3. So these are C3 and C4 point, and these are the places where we are going to put electrode for motor evoked potential. We can take 10% or half of that distance between CZ and C3 and put C1 and C2, C1 on the left side and C2. So we can have 4 electrode for motor evoked potential in order to do any troubleshooting. For sensory evoked potential, we have to measure 2 centimeter posterior to these points. So 2 centimeter posterior to C3, 2 centimeter posterior to C4, and 2 centimeter posterior to CZ. These points are marked as CP3, CP4, and CPZ. So the last point we have to do is 40% anterior to CZ prime, CZ point, and that will be FPZ, or you can go 10% posterior to Inian, 10% posterior to Nasion. That's your CPZ point. So those are the only marks. So CPZ, CP3, CP4, and CPZ, those are the 4 marks we have to do that. We do measurement of the head according to International 1020 system to record sensory evoked potential and stimulate for motor evoked potential. This is very important, so you have to remember that, because if you place the electrode at the right spot, you get the best responses. And for motor evoked potential, you can stimulate at the right spot, and you get responses at low current and with the minimum patient movement. So